Well, hello everyone, and welcome to Weekend Talk. I am Marsha Littlejohn, and I am here with not only Brooke Odom, but Dr. Val Zudans. Wonderful to see both of you.
Good morning.
Good morning. Thanks for having us.
Do you know what's so much fun? I think there is nothing greater than to have someone who can tell it like it is, tell you how wonderful it went, and that's what we're going to be doing today. Because Dr. Zudans, I can tell you, when you bring in your patients, and of course being with Florida Eye Institute and knowing that you're really having these satisfied patients, and every time I talk about you, I say, I have never known anybody who loves what he does more than Val Zudans.
Yeah, it's great to do something where you can help people and enjoy what you do. I really have a lot of fun doing my work, and it's very rewarding to be able to help people to see better. So
it is indeed.
So we brought Brooke to talk about her experience with something really new and exciting that's going on in ophthalmology, a new version of LASIK procedure called iLASIK.
Aha, it's called iLASIK, just the letter I.
Letter I, yeah.
Letter I, LASIK, how terrific. So tell me, Brooke, was it great for you? And tell me about what you were seeing before you had this exciting procedure.
Well, my vision before I had the procedure was pretty awful. I wore contacts daily, and I really didn't have a problem wearing contacts, but I found out about the new procedure, and I thought it would be something I would like to do. And after I had the procedure, I didn't realize how inconvenient my contacts actually were. It was pretty amazing, and I am just so blessed and feel so happy now to have all the conveniences that I never thought about while I had my contacts. For example, I have 2 little girls, and I never thought about it before, but now getting up in the middle of the night is so much easier. Not having to reach and fumble for my glasses, and just being able to tend to their needs and get right back to sleep.
Or looking up a quick number in the telephone book when you had to get your glasses or put the contacts in. Well, how fabulous. Tell me though, when you were having the procedure, I always ask, and Val always knows I do this, did it hurt?
Not at all.
Of course not.
Not at all. I was nervous that it would hurt because I'm very squeamish, and I do not have a high tolerance for pain. But when I went in, Dr. Zudans was so good about explaining to me exactly at the time everything was happening, what he was doing, and it made me so comfortable. I didn't feel a thing, and I came out. It was a little bit like I might have had something in my eye after I came out of surgery, but that quickly disappeared, and I was amazed when I woke up at 3 o'clock in the morning, and my husband, for some reason, had left the TV on, and I opened my eyes and was able to see the TV for the first time since I can remember.
Oh, isn't that exciting? Isn't that exciting?
Very exciting.
And this is one of the reasons, of course, I want all of our viewers to know, this is one of the reasons that Dr. Val Zudans just loves what he does, because you hear this all the time, don't you?
Yeah, how would you like to have a job where you change people's lives with something really simple, safe, and painless? And you know, you hear things, you hear promises about products or things like that, and this is really just a wonderful way to help people to improve their lives that does not hurt. And Brooke was talking about the fear of pain or things possibly hurting, or anytime you're having a procedure, there's always concern about a complication or a problem related to a procedure. What this new iLASIK is in the past, when we did LASIK, we would use there's 2 steps to a LASIK procedure. You make a flap, and then you reshape the cornea. Okay, that first step of making a flap in the past was done with a metal blade. It was an oscillating blade that was sharp that would cut that flap. The new procedure, the iLASIK, does not use anything sharp at all. Nothing sharp comes close to the eye. So this is all done with lasers. It's one laser to make the flap and a second laser to reshape the cornea. So it does not hurt. There's not really anything to hurt, and
it's amazing.
It's incredibly safe. So not only is the patient can be put even at more ease, but also it's great for the doctor, because I feel good that it's an incredibly safe procedure, that the first rule of a doctor is do no harm, and this is just another step towards reducing the risk of complications or problems in a procedure.
Do you know, that it's just so thrilling to know, and of course with the advancements, as you mentioned, what it was originally and how it has advanced into this, and Brooke, you've of course been the recipient of the latest and the most wonderful. Are there individuals though who are not qualified? I mean, I'm thinking really of like years ago, it was because if you had astigmatism, you couldn't do this and do that. We have advanced even to that point, have we not?
There are more people that are candidates now than there were when they originally came out. Originally, you couldn't fix astigmatism,
Yeah.
and there were certain ranges that we are able to treat now that we couldn't treat before. But there are still patients that are not appropriate candidates for LASIK. Okay, one that I see frequently is patients who have already started to develop cataract. Okay, in the mid-50s, early 60s. Sometimes patients will have a mild version of cataract or the beginning signs of cataract, and they come in because they want to see better, but LASIK is not really the ideal thing for them, because once they get cataract, they're going to have to do another procedure, and sometimes it's better just to wait. There are some other conditions, autoimmune diseases, severe dry eye syndromes, if they cannot be treated and made better. And some people are still outside the treatment range. Brooke's vision before the surgery was actually quite poor. She was a pretty high level of treatment, but she could not see the big E on the chart without her glasses. That's how bad it was.
The big E you could not see?
And so, you know, when she's talking about at nighttime, yeah, if she did not remember where she left her glasses, it would be difficult to see those things at night. And so, but there are patients that are even more nearsighted than that, and there is a limit to how much you can do for LASIK. And so, yeah, not everyone's a candidate. As a matter of fact, a decent percentage of patients who come in for a LASIK consultation turn out to not be a candidate. But it's great when they are a candidate, because then you can tell them that you can help them. And dealing with the disappointment, it's actually a little, that's something I don't like doing, telling a patient, I wish I could do something for you, but unfortunately the technology is not there yet for some patients.
And yet there are other procedures as well that you perform that are just absolutely magnificent. Very quickly though, what would be the first symptom? Now I know, Brooke, you were saying that you were not unhappy with your contacts, you were accepting that, but you heard that there was something better, so of course you were delighted. But what if somebody's watching right now, Dr. Val Zudans, and they're saying, how do I know that I could be a good candidate? What about the evaluation period?
The best candidates for LASIK are actually contact lens wearers who don't want to deal with the inconvenience of contact lenses. So that's what most people who come in to see us are. They're doing well with contacts, but they just don't. They want to wake up in the morning and see well. They want to be able to water ski or do outdoor sports and activities and not have to worry about, am I going to lose a contact lens in the middle of this?
Yeah. Boy, I personally would feel that I would be so unhappy having to put contacts in all the time. So really, when you think that you can do something like this and have a great procedure, and Brooke Odom, we congratulate you, because boy, that must be wonderful. And to see those two precious little girls,
absolutely,
that's even better as well. Consultations, people can call you, Dr. Val Zudans at Florida Eye Institute, have a consultation with you to see if they are a good candidate?
Absolutely. The initial consultation, there's no charge for that. We determine whether or not you're a good candidate, and then if you are, we have very easy payment plans that patients can do. It's all the information on that is available on our website.
Terrific.
FLEYE.com. And
you know, there's nothing better than to be able to see, because I can tell you, when I didn't even know that the world was as clean as it was, you know, and that's what happens after you have these wonderful procedures. Thank you so very much, Dr. Val Zudans, and of course his very satisfied patient, Brooke Odom. Thanks and congratulations.
Thank you.
And we'll be back with more. Stay with us.